Hello everyone, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working in Bangalore. Today we will be talking about nasal polyps. So we want to understand what are nasal polyps and why do they form. Nasal polyps are nothing but extra growths which are benign, usually arising from the nose or the sinuses. Predominantly the sinuses that are around the nose, which are known as paranasal sinuses, the extra growths arise for some reason and they start projecting into the nose, and then they will create some symptoms henceforth, right. They arise commonly because of dust allergy, or if there is some other chronic inflammatory process that is going on in the nose or in the sinus cavities. The most common again in that variety would be a fungal infection. A fungal infection inside the sinuses or any one of the sinus will cause inflammatory changes, which will cause the tissues to swell up and it will project into the nasal cavity and it will start creating problems. And typically a fungal sinus is one sided and you will probably see polyps in one side. But a long running fungal infection can also have reactive polyp formation on the opposite side. There are other chronic infections, inflammatory processes in the nose and sinuses which can cause polyps on both sides of the nose. But like I said, the most common reason would be an allergic issue in the nose, and that is triggering the inflammatory change and hence the growth of the polyps. Can nasal polyps disappear on their own without any surgery? Nasal polyps, like I said, is a response to some inflammatory process going on inside the nose or nasal sinuses. Now, unless you deal with the basic issue, the polyps are not going to disappear. Rather, they will be progressively growing and creating more and more trouble. That means nose block will worsen, other sinuses can get involved or physically blocked, their drainage is disturbed, and the other sinuses will slowly start getting involved. The inflammation spreading and polypoidal changes spreading. So, if you deal with the basic cause, say like allergy or fungal infection, the polyps can disappear. But most of the times, once you see the polyps, we will usually try with some medications. If none of them work, then surgery is the way to go. One, of course, to remove the obstruction, and the second is to remove or deal with the primary problem, either allergy or fungal sinus or any other inflammatory process that is going on in the sinuses. So, surgery will become a part of the treatment if nothing else works. Chronic nasal blocks, that is a broad term, right. It is just indicating that the nose is blocked on a long term. Typically in medical terms we say at least 6 weeks plus if the nose block has been persisting. Polyps are one of the least common reasons why the nose will be blocked. The most common in polluted city where we are breathing polluted air, dust every breath, will be allergic rhinitis or the dust allergies or sinus trouble as it is called in the colloquial term, right. So, the dust allergy triggers a congestion inside the nostrils and the tissues inside would obviously swell up in response to that. So, that causes a chronic nasal block, and if you are being exposed to dust over a period of time, few months, few years consistently, the swelling will become sort of a permanent one rather than intermittent swelling, and hence the nose block also will become a permanent one. Eventually allergy can lead to polyps in certain susceptible individuals, but not all of us. Even extremely allergic person may still have only a nose block, sneezing and running noses, but not polyps as a routine. Polyps, as I said, is one of the least common causes for nasal block, and if there is any other tumor, if there is any other growth, there can be nasal block. A deviated septum is another common cause besides dust allergy, which means that the center partition in the nose which divides the right and left nostril will be deviated to either of the sides, or sometimes it can be bent like an S-shaped structure, then the nose block can be there. But the difference between allergy and the nasal septum deviation is that allergy starts occurring acutely, whereas deviated septum is most of the times either by birth or while we were growing during the teens, the bone kind of started bending itself, and after the bone growth is over, it's going to get set in that position. So, this is a very slow process happening over multiple years. That means you will slowly get adjusted to having narrower space in one side and wider space on the concave side. So that doesn't compromise on the total breathing space. Only when the allergy gets involved, or if there is some other inflammatory process or polyps or any tumors, anything like that is happening, then the nose breathing space will get compromised and you will have a nose block. So we don't automatically assume that the nasal polyps are the cause for the nasal obstruction. So it is better to get investigated, at least have a clinical examination done by an ENT specialist, maybe a nasal endoscopy or CT scan of the sinuses will give us a complete picture. Based on that, we can take a call on how to treat that on the long term. Now, if the allergy is becoming more and more active, like it would when the pollution is worsening, then naturally the polyps or any other symptom pertaining to the allergy will get worse. So, if you control the allergy, you may even see the polyps kind of remaining static or sometimes regressing to a certain level can still happen. And early polyps, if you treat the allergy, the polyps can sometimes shrink and give you a nice breathing space. However, as we are inside pollution, breathing polluted air 24/7, if you don't deal with the allergy consistently, the polyps can keep coming consistently. So treatment of the baseline issue is what is going to help you, rather than just having one-off treatment or like that. Just by the sheer property of physically obstructing the airflow, right? If you are not breathing through the nose, then obviously the sense of smell is not going to be there. Why I say this is because the upper 1/3 of the nasal cavity, the roof of the nasal cavity, is where your smell sense organ is sitting, right? So if the air is not passing there, then obviously your sense of smell will be compromised. The sense of smell is acute or better on exhaling. When you breathe out, the air reaches the roof of the nasal cavity in a normal person, and if the conditions are right, the moisture is right, there is sufficient space to allow the airflow, then you smell it. And obviously when you have obstruction in any form, be it polyps or anything else, if the air is not passing by, or when you are exhaling the air is not reaching the roof of the nasal cavity, then your sense of smell will be temporarily affected. It's not a permanent loss, it's only a temporary loss as far as the obstruction is there. You deal with the obstruction, open up the nostril, breathe through the nose completely, then you're going to have your sense of smell back. Now, large nasal polyps, obviously from the name itself, large polyps, they don't respond to medications mostly, for the very simple reason that these outgrowths, the polyps, they don't have enough blood supply. That is why they are greyish in color when you compare it to the normal skin, which is pinkish inside the nostrils and sinuses. They grow without much of blood supply. So even if you take some treatment orally or by way of injections or anything like that, they don't really reach to the periphery of the polyps. So the medications are not as effective. Topical application of say something like steroid sprays and all that can have a minor effect because the dosage is very minimal in the sprays, right? So as they become larger and larger, the treatment will veer more towards surgical, right? If they are smaller, definitely we can try either a topical treatment or oral medications, injectables, or a combination of any of these. But like I said, it has to be a consistent treatment for long term, and we recommend regular follow-ups. Even if your polyps regress with the treatment, it is better that you keep coming back every 3 months to 6 months, depending on the amount of polyps and the severity of polyposis, how fast they grow. You have to keep a regular follow-up so that we can identify, even if there are some changes happening, early changes of polyposis, then we can identify and treat them early. So you don't have to go to the extensive treatment or on a preventive or regular permanent treatment. If you can prevent when they are smaller, your nose will remain fine, right? Home remedies, yes, there are few things which people do try. They've tried multiple oils, multiple creams, and nasal drops and nasal sprays. Like I said, if the polyps are smaller, any one of them could help. There is no 100% guarantee that home remedies or medications are going to be 100% relief. But keeping the nostrils clean, reducing the dust exposure, nasal washes like Jal Neti or commercially, medically available nasal washes, saline nasal sprays, all these can be done. People do Jal Neti on a regular basis. We have seen the polyps kind of at least remaining the same or sometimes regressing. Obviously, what they achieve during a Jal Neti is to remove the day-to-day dust which is fallen there in the nostrils. Hence, the reaction of the nasal cavity will be lesser and the polyps can remain static or shrink. And another advantage of doing nasal wash or Jal Neti is that your skin inside the nostrils and sinuses can become slightly less sensitive and maybe slightly thicker, so it does not respond to that amount of dust as usual. So, that also reduces the inflammatory process and hence the polyps can shrink in the long term. But again, this has to be a consistent treatment that you keep doing regularly with timely follow-ups.